Despite advancements in dental technology, the incidence of periodontal disease continues to be a serious problem, and new alternatives for prevention need to be considered.
Periodontal disease is very rampant in today's society. If you look at a population, you will have more people that have some form of periodontal disease than you will that are healthy.
Gum disease is a very serious problem today, and unfortunately we've, as the profession, have been telling people to brush their teeth, and what they really should be doing is cleaning in between their teeth.
Home care is the most important thing, and flossing rates right up there at the top. The problem is we can't get most patients to floss.
The ADA reports that almost 50% of patients never floss, and only 12% do so daily.
Despite the fact that the profession, both dental and dental hygiene, has been harping on people for years to floss, people just don't floss, and they want alternatives. And if they can find alternatives that are easy to use and effective, they'll comply.
Now there's an easier and more effective alternative than string floss for your patients who don't like to floss: the Waterpik Water Flosser.
It tells exactly what the product does.
Patients don't really realize that they can use a Waterpik instead of flossing.
We have tried for years to get people to floss, and they've heard us say, floss, are you flossing? Have you been flossing? Do you floss?
Introducing the Waterpik Water Flosser. The research is clear. The Water Flosser is an easier, proven, more effective alternative to string floss for your patients who don't like to floss.
In particular, I'm impressed with the clinical studies that show reduction of inflammation, improvement of overall periodontal health, and also reduction of various biological mediators that foster the advance of periodontal diseases.
A major study conducted at the University of Nebraska showed that the Water Flosser, in conjunction with brushing, proved to be up to 93% more effective at reducing bleeding and up to 52% more effective at reducing inflammation compared to string floss. A similar study recently conducted at the University of Amsterdam showed that after 14 days, the Water Flosser was twice as effective at reducing gingival bleeding than string floss. And after 30 days, the difference was even more dramatic.
The Amsterdam study clearly indicates that the use of the Water Flosser dramatically reduces gingival bleeding and also improves overall periodontal health.
To better understand the Water Flosser's effect on plaque biofilm, a study was conducted at the University of Southern California. In this study, the Water Flosser was shown to remove 99.9% of plaque biofilm from treated areas.
Now, we've been studying biofilms now for 40 years and dental biofilms intensively the last 4 or 5 years, and quite clearly they're very recalcitrant biofilm, very, very difficult to remove.
Extracted teeth with heavy concentrations of plaque biofilm were subjected to a 3-second treatment with the Water Flosser and viewed under a scanning electron microscope.
You apply the Waterpik to a plaque on the surface of a tooth, and you look with a scanning scope, and it's gone. It's simply gone. And that's unequivocal and unarguable.
The Water Flosser is easy for your patients to use. It takes only a minute a day and will leave your patients with a clean, fresh sensation. It's a regimen that will improve patient compliance and make your job easier. It's an excellent option for anyone who wants to improve their oral health. There are 6 unique tips specifically designed for their individual needs. For your orthodontic patients, the orthodontic tip is clinically proven to be 3 times more effective at removing plaque biofilm versus string floss. For patients with periodontal pockets, the PIC pocket can deliver antimicrobial agents deep into the periodontal pockets, up to 90% of a 6mm pocket. The toothbrush tip allows patients to brush and water floss at the same time. And the tongue cleaner tip removes bacteria from the tongue and helps to eliminate bad breath. The classic jet tip removes plaque biofilm deep between the teeth and below the gum line, while massaging and stimulating the gingival tissue. The Plaque Seeker tip is designed to give your patients the benefits of pulsating water, plus 3 thin tufts of bristles to access the stubborn plaque around implants, crowns, bridges, and other areas that are susceptible to plaque accumulation.
We don't even ask our patients to floss anymore in our orthodontic practice. We realize that it's a losing battle all around. Ever since we started recommending the Waterpik Water Flosser, we see better results than before.
The message that I'd like to give to my fellow dental professionals is that the water flosser has been proven to be an effective adjunctive means to remove interproximal dental plaque and reduce gingival inflammation and bleeding of the gingiva.
Look at the evidence. You can look at the research behind it. Check with your patients. Try it out. Have them use it. See how many more patients become compliant. You will be a believer also.
The Waterpik Water Flosser, the easier and more effective solution for your patients who don't like to floss.